Are you suffering from lower back pain? Are you desperate to find the right doctor who can give you the right scan, an x-ray, a CT scan, or an MRI so you can figure out exactly what's going on, so you can figure out what to do, whether that's medicine or surgery or physical therapy? If that's what you're looking for, I have some really bad news. In most cases, scans are not only not helpful, they're even counterproductive. But wait a minute, isn't knowledge power? How could it possibly be that taking a look and knowing exactly what's going on isn't helpful? This is the weird paradox of scans and back pain, and that's what we'll be exploring today. In 2019, there was a systematic study that looked at outcomes from scanning people for lower back pain, and they found overwhelmingly decreased outcomes, increased costs, increased pain, and increased time away from work. Misdiagnosis was very common. A British medical journal article also found that only in 5 to 10% of cases with lower back pain was there anything pathological going on anyway. And even in those 5 to 10% of cases, the protocol for healing is still pretty much the same. But still, why would looking at a scan be a bad thing? Many times when people look at scans, what they find is scoliosis, 3% of the population. What they might find is degenerated discs. What they might find is maybe even a stress fracture they didn't know was there. And while in most cases knowledge is power, in this case, ignorance in many cases is bliss. Hey, my name is Lucas. I'm a yoga teacher and trainer. I have spent a huge part of my career working with people who have back pain. It was inspired by my own back pain challenges many, many years ago. And I'm always trying to learn and recommend the best information for my students. And in this video, we will talk about, number one, how to do self-assessment at home. Number two, the 6 to 8 week window. And this is when, regardless of your path forward, usually all of the responsibilities on yourself. So how you can accelerate your healing and do the best to take care of yourself. And then number three, we'll talk about if and when medical intervention is necessary. Quick disclaimer here, this is for educational purposes only. If in doubt, please check with your medical professional. I am a yoga teacher. Down below, you'll find a PDF to everything we're talking about here, including language you could use with your doctor, including things to think about when doing self-assessments at home. Okay, so this scan, no scan paradox, still kind of confusing. Let me share with you an analogy that might make things click. Have you ever had a cold or a flu and you went to the doctor convinced that you needed amoxicillin or a Z-Pack to get better, to just wipe it out? And your doctor said, Lucas, forget about it. This is viral, it's not bacterial. These antibiotics you want, they're not going to help. In fact, they might do more harm than good. They might wipe out your gut bacteria and they might desensitize your body to this antibiotic you might need in the future. And very frustrated, you march on home, but you know that the doctor is right. This is a similar scenario with scans. Most of the time, the information they give you is either going to give you a big nothing burger, zero, no information, or even worse, you discover something you didn't know, you didn't need to know was there, that suddenly becomes catastrophized in your mind. What should you do instead? For most people, if you lifted a heavy box and you hurt your back, if you were out on a bike or you were skiing and you slipped and you fell and you're feeling severe back pain, self-assessment at home can be a really effective first step. What self-assessment really starts off with is trying to determine, do you have muscle pain, disc pain, or nerve pain? Those are usually the big three. And if you're new to back pain, it can be very difficult to discern. Let me give you a couple of ways to discern muscle from disc from nerve pain. Muscle pain, which could be affecting your quadratus lumborum, your erector spinae muscles, or other smaller or larger muscles of your back, very often happens from lifting. It might happen from a hardcore gym workout, a new movement pattern. It might happen through a sudden lift and torque movement. But muscle pain is often worse in the morning, worse when you're sitting. And if I were to ask you, where does it hurt? It's often a general area, such as this. You'll rub your hand instead of pointing specifically. With movement, muscle pain dissipates very, very significantly, meaning just walking around doesn't mean it'll go away, but a massive reduction. Muscle pain gets better significantly day on day. So if you have muscle pain in your lower back today, tomorrow it might not be gone. A week from today it might not be gone, but it will be way, way better. With disc pain, whether that's a bulging disc, a full herniated disc, degenerated disc, the pain is often a lot more localized. Instead of rubbing like this when you show me where it hurts, oftentimes you might be able to point with 1 or 2 fingers. Disc pain is often worse in the morning and after sitting, like we mentioned before, but it doesn't change so much with movement. Movement will help, but it doesn't drop off a cliff like it does with muscle pain. Disc pain also doesn't resolve nearly as quickly, whereas muscle pain will make this steady progress back to baseline. When you have a disc issue, because these tissues heal so much more slowly, it's more like a steady crawl. So today might not feel much different than the end of the week. And a week from now, maybe a little bit different, but not so notable. When it comes to nerve pain tends to radiate, and it tends to be a little electric or numb in feeling. This is called radiculopathy, and very common with lower back pain is to have radiating sciatic nerve pain down your butt, down your leg, and possibly even all the way down to your foot in your lower leg. As you might have guessed, these three can all go hand in hand, muscle, disc, and nerve, but often they don't. Often they're separate, although a disc compression and a nerve impingement can go hand in hand. So the first thing is to try to determine what you think is going on. This will help you set an appropriate timeline for healing, which is what I'd like to talk about next. You need to identify which movements you have an intolerance to. Let me give you an example. Let's say that you have a gluten intolerance or a lactose intolerance. What would you do? Well, you'd avoid gluten. You'd avoid lactose. Let's determine if you have some movement intolerances, meaning certain movements that are just totally off limits for you right now. The first one is the most obvious and the most common, which is a forward flexion intolerance. What that looks like is simply imagine you're reaching forward to tie your shoes and see if you get a sharp shooting pain, whether that's the generalized muscle pain or a localized disc or nerve pain. If you find a red light flashing, remember that, make a mental note, that those are your guardrails. That is your forward flexion limit, and when you bend forward to tie your shoes, avoid that range of motion in the next 6 to 8 weeks. That means bend your knees more, that means load your hips more, that means use support if you need to, if you have a forward flexion intolerance. The next one is, well, instead of going forward, we go backwards. So simply extend your spine as if you were moving into a back bend. And again, look for that red light flashing, that sharp shooting pain, maybe electrical take your breath away sensation. When you find that area, remember again, what you've discovered are your guardrails for the 6 to 8 week healing period. The next movement that we need to look at, this is much less common, but still worth looking at, is called axial rotation. If you extend your arms and twist, extend your arms and twist, again, what we're looking for is a red light flashing. Now this last one, probably second in commonality only to our forward flexion intolerance. This is a compression intolerance. If you lift your heels and slam them down, how does that feel? If you lift your heels and slam them down, how does that feel? And again, what we're looking for is that, take your breath away, that sharp shooting pain. And it might be localized, it might be generalized. We're trying to get an idea about what types of movements are going to be contraindicated for us on our healing journey. Now that we've got a better idea of whether it's muscle, disc, or nerve, now that we've got a better idea of which movements are totally off limits for us, now we need to look at our 6 to 8 week window. Where do I come up with this number? If you look at the published literature, the vast majority, 90 to 95% of back pain, will resolve in 6 to 8 weeks. 6 to 8 weeks is long enough that you will really get frustrated, but it's also short enough that you can get excited if you mark a date on your calendar and you take action to accelerate that, so more towards the 6 weeks, less towards the 8 weeks in terms of your healing journey. And keep in mind, you can get better as you go. What does a healing journey look like? It doesn't look like lying flat in a bed. It doesn't look like Netflix and couch. You have to stay active, but you have to avoid those pain sensations. No pain, no gain does not work. You need to move pain-free. Think about strength, think about stretching, think about balance, and also think about walking. This is a really helpful paradigm, whether you have a herniated disc, whether you have spinal stenosis, whether you have a simple muscle strain. The healing protocol is really pretty simple. If you can walk pain-free for 30 minutes a day, do that. If you can do some basic body weight strength training every day, do that really carefully. Some basic stretching as well. This is more than we can go into in this video, but if you're looking for some self-care, strength, and flexibility balance videos, please check my channel for more options. Okay, let's imagine our magical 6 to 8 week window has passed. Or let's imagine that your back pain is not resolving on a week-to-week basis. It's actually accelerating. It's getting worse. Let's imagine your pain started here and it went here and now it's radiating down your leg. Let's imagine it was a minor nuisance and now you can't go to work, you can't sleep, you're having trouble controlling your bowels. You need to go see a doctor. Who do you go see? The first people many people call is a chiropractor. I would advise against that. Chiropractors are not medical doctors. They don't have access to medicine. They don't have medical equipment. They can't do scans if that's necessary. And they don't have the allopathic interventions that you may or may not need. You might start out with your general practitioner. You might go see a specialist like a sports medicine doctor. They might refer you to a physical therapist. But make sure you go to a medical center. This is not a time for a chiropractor or a body worker or a massage therapist. Were you to experiment with those healing modalities, that would be in your self-care window. Hope you found this helpful. Back pain can be overwhelming. Back pain can be scary. Looking at 2 months on the calendar can feel like a huge block of time, but it goes by faster than you think. When you're proactive, when you're deliberately moving, strength, flexibility, balance, and walking, but you're avoiding pain, it can be a really empowering time where you can learn more and you can end up after your back pain journey stronger than when you started. If you found this video helpful, hit subscribe down below. I publish science-based yoga videos every week. If you have an experience with a medical doctor, good or bad response from scans, I'd love to hear from you down in the comments below. I put a PDF down below with some links and references as well. You can find my teaching calendar at yogabody.com, and I'll see you in the next video.